Hello everyone, welcome to the Lab Informants. This is a platform that helps you to know about your health conditions and also the role of laboratory in management and the diagnosis of your health conditions. Our today's presenter is Mr. Eric Masiga, and today we are going to discuss about hypertension. Here are the key takeaway points that we're going to talk about. We'll help you understand what blood pressure means, what hypertension means or high blood pressure, what causes hypertension, classification and types of hypertension, signs and symptoms of hypertension, the complications that come along with hypertension, the laboratory diagnosis, and mainly the role of laboratory in diagnosis and management of hypertension. We'll also discuss with you about the management of hypertension and as well as the current data about motility and morbidity that is brought by or as a result of hypertension. By definition, blood pressure simply means pressure that is exerted by blood on the walls of the blood vessels while the blood is flowing through the blood vessels. And an ideal blood pressure is approximately 120 systolic and 80 mm mercury diastolic or lower than that. Many people ask themselves, what is hypertension? Hypertension is simply an increase in blood pressure. It is absolutely necessary to note that hypertension is also known as high blood pressure, and the only way to know if you have a high blood pressure or hypertension is to have your blood pressure tested. Understanding your results is key to controlling a high blood pressure. As illustrated by the images in this slide, a high blood pressure may be as a result of accumulation of plaques in the walls of arteries, causing the arteries to thicken and lose their elasticity. The blood pressure is created when there is a force of blood pushing against the wall of the blood vessels, such like in these arteries here. There are majorly two types of hypertension, and each type has a different cause. The two types are primary hypertension and secondary hypertension. Primary hypertension is also called essential hypertension, and this type of hypertension develops over time with no identifiable cause. It is the most common type of hypertension. However, the secondary hypertension is the hypertension or a high blood pressure which has an identifiable cause. The cause may be another condition or a disease. There are several conditions which may cause secondary hypertension, and some of these conditions include kidney disease, obstructive sleep apnea, congenital heart defects, thyroid problems, side effects of some medications like birth control pills, use of illegal drugs like cocaine, alcohol abuse or chronic use of alcohol, adrenal gland problems, and also certain endocrine tumors. Classification of high blood pressures. A normal blood pressure should be systolic blood pressure of 120 or less and a diastolic blood pressure of 80 or less. Prehypertension is between 120 to 139, the systolic blood pressure, and diastolic blood pressure being between 80 to 89. Someone is considered to be hypertension stage 1 when their systolic blood pressure is between 140 to 159 and their diastolic blood pressure being between 90 to 99. And stage 2 hypertension is a pressure that is above a systolic blood pressure above 160 and a diastolic blood pressure of above 100 mm mercury. Stage 2 hypertension is also termed as hypertensive emergency. Signs and symptoms of hypertension. Hypertension is generally a silent condition, and many people won't experience any symptom. However, others may experience severe headaches, shortness of breath, nose bleeding, severe anxiety, feeling of pulsations in the neck region or the head, and as well as dizziness. Hypertension can cause serious complications in that an over time uncontrolled high blood pressure can lead to arteries around the vital organs to narrow, weaken, or harden, leading to these organs being dysfunctional or organ failure. To the brain, hypertension can lead to stroke or dementia, which is a condition that affects memory or thinking capabilities, and it does really interfere with the daily lives. Hypertension causes eye damage, a condition known as retinopathy, which leads to blindness. And to the arteries, hypertension can damage the arteries and causing the arteries to narrow. Hypertension also causes the arteries to bulge outwards like a balloon, a condition known as aneurysm, which can lead to leg amputation. Hypertension also affects heart, causing conditions such as coronary heart diseases, heart attack, or congestive heart failures. And it can also affect the kidney, causing kidney failure or kidney artery aneurysm, where the renal arteries bulges like a balloon and weakens the area in the wall of the artery to the kidney. Management of hypertension. In order to manage hypertension effectively, we have control measures and we also have preventive measures. Preventive measures are measures that you can put in place in order to prevent yourself from getting hypertension. And this includes reducing salt intake, increasing the rate of vegetable and intake of fruits, avoiding saturated fats, avoiding smoking, reducing alcohol intake, and as well as doing exercises regularly. If you have hypertension, here are some of the control measures that you can put in place in order to manage your hypertension effectively. You should follow medical advice and also adhere to lifestyle changes, like for example adopting DASH diet. You should also take medications as prescribed by the doctor. You need to be checking your pressure regularly and as well manage and reduce stress. It is very important to understand that routine lab tests should be performed before beginning of treatment of high blood pressure in order to determine the organ or tissue damage or other risk factors. And here I'm going to discuss with you about some of the lab tests that are to be performed. To begin with, catecholamines can increase blood pressure, heart rate, breathing rate, muscle strength, and also mental alertness. And without forgetting, some rare tumors such as pheochromocytoma can increase the amount of catecholamines in blood, causing a high blood pressure or excessive sweating and headaches. Therefore, in some cases, a doctor may order catecholamines and metanephrines to help in diagnosing or establishing the cause of high blood pressure. Secondly, cortisone and dexamethasone are involved in blood pressure regulation, such that an excess release of cortisone induces hypertension, while inadequate production of cortisone causes a life-threatening low blood pressure. Dexamethasone suppression test is used to assess the abnormal levels of cortisone in response to the dexamethasone injection, primarily to diagnose Cushing syndrome. Plasma renin activity. Renin is an enzyme that is made by special cells of the kidneys, and it helps controlling blood pressure. Therefore, when the blood pressure is high, it is essential to also determine the amount of plasma renin in order to get the right treatment. To add on, a urine routine examination, full report, can be used to screen for secondary causes of hypertension and look for the damages to the kidneys as a result of an overtime untreated hypertension. Some of the laboratory tests that are performed in order to help diagnose and also evaluate hypertension includes blood chemistry, such as potassium, sodium, creatinine levels, fasting glucose, and also cholesterol levels. Albumin-creatinine ratio urine is also called urine microalbumin, and this test is used to evaluate an early stages of kidney disease, which may be caused by complications of diabetes. In some cases, if diabetes is not well managed or controlled, it develops to complications such as high blood pressure, which can lead to kidney disease. Therefore, an early diagnosis of kidney diseases in patients with diabetes by urine microalbumin aids in appropriate treatment, and it does control its complications like high blood pressure, as this is being closely monitored by the test. In last order of mention, we have the thyroid function tests. The thyroid function tests are blood tests that measures for the amount of hormones made by the thyroid gland. When the thyroid gland does not produce adequate thyroid hormone, a condition known as hypothyroidism, or when these glands produces too much of the thyroid hormone, a condition known as hyperthyroidism, a high blood pressure can result. Furthermore, overproduction of parathyroid hormone triggers high blood pressure. Therefore, quality laboratory testing in determination of both thyroid and parathyroid hormones provides a key information in accurate diagnosis and Management of hypertension.
If a patient routinely submits to lab testing, this might allow doctors to respond swiftly with preventative treatment, which could save the patient time, money, and possibly sickness in the future.
Role of laboratory in management and diagnosis of hypertension. Laboratory professionals are the detectives of healthcare world, and laboratory testing provides accurate information that aids in quality management and diagnosis of hypertension as a condition. First and foremost, the information that is obtained from lab testing is used to make diagnostic decision. That is, it helps rule in or rule out the cause of hypertension in its diagnosis. Secondly, the information that is provided from lab testing can be used to check for the efficiency of the drug or drug monitoring. After a diagnostic decision has been made, that is, hypertension has been ruled in or been diagnosed with hypertension, the doctor may see it necessary to prescribe for you some medications in order to manage the hypertension. And it is absolutely necessary to conduct subsequent testing to evaluate the efficiency of medication or drugs, in that the subsequent laboratory readings should be better than the previous laboratory findings. Last but not least, laboratory testing plays a key role in management of hypertension through screening tests, which are a very important part of preventive healthcare. This is because through screening tests, an early detection gives the best chance for getting right treatment and quickly avoiding any health complications. Statistically, according to the National Library of Medicine, raised blood pressure or hypertension is responsible for 7.6 million number of deaths per year worldwide. This is about 13% of the total number of deaths, more than any other risk factor. Around 54% of the number of deaths that occur due to high blood pressure are of stroke, and approximately 47% of these deaths are of coronary heart diseases. It was also established that over 80% of the number of deaths that occur due to high blood pressure burden occurs in low and middle income countries. Summing it up all, hypertension is a non-silent killer, and don't take hypertension for granted. And even so, as Biopersonal Diagnostic says, going for a medical checkup regularly will help you avoid a wide number of diseases and catch other diseases early on. Stay blessed, stay tuned, follow us for more videos like this, and have a nice time.